All right, I understand that we have the latest with regards to our breaking news story about the third wave that has hit Gauteng. This is according to Premier David Makhura. Griselda Lewis was in conversation, I understand, with the Premier. Let's take a listen.
Perhaps to put further restrictions on Gauteng in light of the announcement that a third wave has now struck the province. And I don't know if it would either be MEC or the Premier as well would want to answer this. You did highlight as well the importance of the vaccination of the healthcare workers. MEC, yesterday we saw some chaotic scenes at Mill Park as well as in Pretoria, where shortly after 4 o'clock in the afternoon, some of the healthcare workers had to be turned away. They were told to come back today. They were quite irate. A couple of hours standing there, they were told that there was no longer vaccine. A statement was also sent out by George Mokari indicating that they've run out of doses. They've stopped the Sisonke trial. How are we going to deal with that? Gauteng is now in this, has been hit by this third wave. Yet you have a situation where 210,000, you've indicated, healthcare workers still need to be vaccinated. Is this not a crisis in your view? Thank you.
I think you've covered me. I think she has covered me. We also want the same thing.
Hi, Premier Sbahle from Jacaranda FM. So my question is on the over 60-year-olds. Obviously, you've said that on Monday you'll be visiting all the old age homes. Just the strategy of that. And secondly, how are you hoping to get access to the ones who have not registered? And how many elderly people have already registered for the vaccination program in Gauteng?
Premier Tsepo from SABC Radio News. Premier, you mentioned that you have 61,000 vaccines. 15 healthcare workers still need to be vaccinated. The number, obviously, of the vaccines that are available and the number that still needs to be vaccinated, and you're adding the elderly, you want to do this simultaneously. Obviously, there'll be a problem there, Premier. Denosa is saying delay the rollout of the second phase. Would you do that? Because you've just announced that Monday you hit the ground running, you're visiting old age homes. These people are saying that, delay a bit because you might be sending soldiers into a battle unarmed. Would you consider that, Premier?
I would like the MEC to start, especially with the vaccine, the vaccine rollout program. I would like her to take the seat where I am, because the mics are here, MEC. Unfortunately, you have to come and sit. This we do for the media.
Protocol.
Where are the sprays?
Thank you very much. Can I go on?
I think you can also use this.
Okay. Maybe just to clarify that those healthcare workers who are not vaccinated will also be part of phase 2 1B. And I think we did announce that we are not allowing walk-ins. You are only going to be considered when you're having a voucher. And maybe to also indicate that the Sisonke program will be closing tomorrow. So we have finished the doses that were allocated to us. Bara has concluded, George Mokari, and there's a few that still needs to be concluded by Charlotte. So I just want to convey the message to the health workers that don't panic. As soon as we get vaccines, we will be able to vaccinate. But there will be a concurrent implementation or rollout of both the elderly and the health workers at the same time. I hope I've answered your question, Griselda. Thank you.
Thank you very much, MEC. So firstly, the 61,000 that we got was, when we met at our command council on Tuesday, 61,000 was the allocation as of that time. You should note that vaccine batches are arriving, and the minister has been announcing, so as they arrive, they indicate in the new batch what the allocation is. So this is an important thing to take into account, that if 300,000 arrives, we get allocated out of that. We're going to get another allocation. But what is our focus is to make sure the ones that are allocated are out there, as I said, on the arm. Or the question was asked. I'm sorry. So I want to say 61,000 was the initial allocation. As more vaccines arrive, we get allocated per province. And the critical thing for us is to ensure that every allocation is particularly exhausted by ensuring that it goes to those who are registered. I want to emphasize, we are doing a lot of work. We set up actually a call center where we have people phoning the elderly people across the province to advise them. We get lots of good feedback to assist them to register. So if you ask, how are you assisting? We are having direct communication using the call center. And that call center has helped us a lot to improve, even where there was a bit of vaccine hesitancy. The call center team is well trained. They are able to explain where there's doubts or questions around vaccines. So I am not too worried that at the moment we got only 61,000. I know the allocation will be coming every week. We will be getting a set of vaccines, and when we get more, we will be able to reach more. Yes, it's the simultaneous vaccination of healthcare workers and the elderly. That is the wisest thing to do. If anyone is saying that we must stop continuing with the elderly and wait until we're at this moment in our country, we really have to do as long as we've got a certain number of vaccines, we must do it simultaneously. The first category, healthcare workers and the elderly, because those elderly people are also at great risk. I want to repeat, in Gauteng, we have vaccinated over 100,000 healthcare workers, but the total is 215. So we still have 115, and in fact by last night the number may change slightly. It may be over 100,000 as a couple. But we still have another 100,000 or so healthcare workers.
Right, as you can see, that network is not good at all. We will try whatever we can to reestablish that connection. But what do we know at this stage? We are talking about the Premier, David Makhura, saying that he's announced that the third wave of COVID-19 infections has hit Gauteng, and he was giving us some numbers, and this is what we were getting from our reporter Griselda Lewis, who's on the scene there as we speak. She says that as the Gauteng Premier, David Makhura, announces a third wave of infections has hit the province, he says that there are 4,500 beds in the public sector alone and over 5,000 staff to help cope with the third wave. And then, as you heard a short while ago, he mentioned with regards to the healthcare workers that have been vaccinated, over 100,000 healthcare workers have been vaccinated in the province, and there's still 215,000 more who need to get the jab. What are we talking in terms of national figures? In terms of national figures, rollout, let me try and get that figure for you. In terms of national figures, vaccination so far completed under the Sisonke protocol. As of yesterday at about 6:30, we got this figure of 455,169. That is where we are at the moment. I want to bring in the South African Medical Association's national chairperson, Dr. Angelique Coetzee, back into this conversation. Doctor, thank you very much indeed for your time. Firstly, your reaction to what the Premier had to say about this announcement of the third wave that has hit Gauteng.
It's very difficult to say that we are already in a third wave, in a proper third wave. Remember, you need to have, per definition, 6,000 cases per day for at least a week or more to say that you are now in a proper third wave. What we do see, however, there is an increase starting we are starting to see an increase in the numbers of patients infected with the COVID-19. So, but it's not that high yet as to say officially on the grounds of the maths that we are in a third wave.
But when he talks about the province of Gauteng, that is possible, or are you questioning some of the information that he's giving us?
So there's two ways to look at this. If you look at the current figures, it's not there yet again as per the definition. But I think that we can safely say that not all people are being tested, especially in the public sector. So if you look at the daily stats, you would see there's always more testing done in the private sector than in the public sector. So if you then take into account that maybe we have a lack of testing in the public sector and that our numbers are actually much higher, then yes, you can say on that, if you do that math, right, maybe we are now in the third wave.
So the lack of testing also forms part of the calculus when you declare that a province or a country is in a third or fourth or whatever wave there is.
Yeah, you need to look at that. But for us, the best measurement currently, because we know there's a lack of these numbers being reported or tests being done, the most or the best indicator would be to look at your private hospitals and the admission rate into the ICU and high care of patients with COVID-19 disease, as your private sector hospitals are much more, or tends to do on a daily basis. They give their numbers to the national data center. Right. So you can trust those numbers. So if those numbers go up, then you know there is it's like a red flag. There's something going to starting to happen.
So if, for all intents and purposes, the Premier is right in that we are in a third wave in the province, what does this mean for how we take this fight against COVID-19 forward?
We have been saying the same things for more than a year and a half now. We keep on warning people to stay away from groups of people. We keep on advocating that you need to wear your mask, the whole thing. And we keep on saying the same things over and over, but it seems to us that people doesn't understand this. And we have said how many times that when winter comes, if we don't get our third wave after Easter weekend, we will most probably see it in the winter, because people tend to be together and they do not open their windows for air circulation to be available, so that we do not sit with the same air the whole time where the virus is. You cannot use your air cons. You have to have natural air ventilation. And people doesn't know. So I always fail to see why people are all now astonished that we are moving into a third wave. We have been warning you for how long that's going to happen. And take your vaccines.
This, talk to us about those dynamics, and maybe it'll be better for people to understand why scientists are saying hold outdoor events rather than indoor ventilation. Talk to us about the science behind those requests from the authorities in terms of the virus and how it spreads. Initially we were told it's a respiratory, these droplets. Talk to us about how the humidity affects the weight of the viral load. Just break it down so we understand why it's so important to do this.
I'm going to try to make it very easy. So it is true, it's a respiratory virus. It's a heavy droplet, but there is still concern that there might be finer droplets that can be distributed via aircons. So it's difficult if you don't have the right aircon. If you've got an aircon system which is linked with other aircons, and you keep that on and there's no ventilation, then you can actually spread the virus. So you need 6 cycles of natural ventilation per hour in a room. To get that, you have to open up the windows. It's easy. It's not difficult. You just open the windows. Then, if you stay outside, there's natural ventilation. That's outside. That's why it doesn't make sense to us not, to not allow people to go to beaches. But the moment when you are in a place where there's no good ventilation, like a hall, or a church, or a shopping center, any of those things where there's 4 walls around you, you are then starting to get yourself exposed to viral droplets that stays there.
Right. So, look, one of I think it forms part of the calculus as well when we're tackling COVID-19 as a country as a whole, is the issue of COVID fatigue. Where you get so tired of being tired, of worrying. You don't want to follow these non-pharmaceutical interventions, washing your hands, wearing a mask, watching your distance. How do we overcome that? Easier said than done to just keep on doing what we're doing or what is advised to do. But how do we overcome this so-called COVID fatigue?
Very good question. I think the easiest answer there will be that all children under the age of 5 will not have these difficulties in a few years from now on. Yeah. For them, that is the normal, and that's the norm. The older you get, the more wiser you get, and the more you think you know better, and the less you want to do this. And the young people think they are invisible, and because of the youth, and I can't say to them you're wrong, because when you're young you can conquer the world. Therefore you don't need the masks, but unfortunately during this, not even the fact that you get vaccinated is going to take away the mask, the social distancing. We have to get used to that. We have to. Maybe it's easier for us as medical doctors because the wearing of a mask and the washing of hands is something that comes natural with your work, and maybe in that case also it makes it difficult for us to understand why people's behavior is what it is currently, and they get fatigue. But you can't get fatigue. The moment when you get fatigue, except if you've got a very good medical scheme, you are healthy and you don't mind getting the virus, then it's fine.
I don't think anybody wants to go through that. Prevention is better. Why? Is because you don't want to deal with the unknowns, isn't it, Doc? Yes. I mean, there's so many unknowns with regards to COVID-19. It seems like scientists and the world at large are learning about these things in real time. So you don't want to put yourself in that position. What about vaccine hesitancy? What's your level of concern? I don't ever explain this to you, but for the viewers, it's a delay in acceptance or refusal of vaccines, despite it being readily available. And it's a complex issue because it has to deal with a number of factors such as complacency, such as confidence in a vaccine, because this vaccine was created in such a pace that some people think, did everything go according to plan in order to get it to be effective? What's your level of concern?
Yes, I am concerned. So, and as you said, it's a multifactorial or a complex problem. Yes, you get your vaccine. People who's hesitant to take the vaccine, they're hesitant to do anything in any case. So, and then something that we have seen in South Africa, we are a country that loves to complain, and we love to come up with beautiful plans, but we're not doers. So we are sort of sitting in the back and watching and saying this, it must be like this and this and this and this.
Yeah.
But as long as I don't need to do anything. So that is also, it's that they are apathetic, they don't want to do things. And that's a problem going forward, because we know that it's not going to be easy next week when you start with the rollout.
Yeah.
We from SAMA side expect a lot of problems. But you, as the person out there, you have a choice. And it's your choice. I cannot say to you, you have to do the vaccine.
Yeah.
I can say to you that if you are over 60 and you have comorbidities and you're not on a medical scheme and you are one of those people who get flu or get easily sick, take the vaccine. If you don't, you have a good chance to take the virus. And as you have said a few minutes ago, we don't know. I cannot guarantee anyone here that you will have a mild COVID-19.
Yeah.
And even if you take the vaccine, there's still a 20% chance that you can get COVID in a severe disease. But it's less than it would have been if you haven't taken the vaccine. So you have to make a choice looking at what's the pros and the cons. You cannot come back later and tell us that it's our fault that you get sick.
No, I hear you, Doc, with regards to the choice. Before I let you go, I just want to throw in this last one, speaking about choice. Look, it's easy for me as an adult who will reason and weigh up the pros and cons in terms of taking this vaccine for emergency use. It has been declared safe. That's one thing. There's another thing of me maybe taking the decision on behalf of my child. I will be very circumspect as a father, as a mother. I want it to be 100%. I know no vaccine. I know there's always side effects, etc., etc. I see Pfizer has come out with this vaccine. The CDC in America reportedly recommends the use of Pfizer vaccine for 12 to 15 years old. Where are we in that conversation about vaccines for children, and how should us as South Africans, us as parents, approach it?
So we're not there yet. And I think what would be prudent is to wait and see what happens with those children being vaccinated in America. Yeah. I think they would have good surveillance on side effects, and we can learn from that. Why I'm saying we are not there yet. We have not even started to roll out the vaccine to our country as the adults in a phase 2. Yeah. So you cannot jump from, and starting to think about the children. I think we first need to see how we're going to roll out and all the hiccups and how to overcome that before you start thinking about the children. Yeah. Because for now, we know that the children are not getting severe disease that easily. If they do, there's other factors in play.
Doc, we got to go. We thank you very much indeed for your time and your insight. Be well. All right.
Thank you.
Dr. Angelique Coetzee. They're giving us an insight on our breaking news. The third wave of COVID-19 infections has hit Gauteng. That's according to the Premier, David Makhura. We'll follow up on that shortly. Another story we're following up on is David